Whenever a patient, a human being, hears the word terminal cancer, he is or she is devastated, and the family members are also devastated. Pancreatic cancer is almost invariably fatal. The words terminal cancer puts the entire family in a state of shock. The patient has a very hard time understanding what is going on. It is grief, and they go through different phases of grief. Initially, the very first stage is the stage of denial. They have a hard time believing that they have a terminal cancer. So many patients are in denial. They will not even go to have any testing done, to have any treatment. They would go about life as if they do not have any disease. When they realize that the denial doesn't work, then they become very angry. During that phase, which is the anger phase, they question, why me? I have done so many good things in life, and why do I have this terrible disease? So they go through that anger. They also tell themselves that all my good karmas have come to naught. And after the phase of anger, the third phase that almost every patient goes through is bargaining. They bargain, so to say, with God or superpower. They may do some charitable work, they may visit temples or churches, and they feel that somehow this bargaining will cure them of the terminal cancer. Then it dawns on the patient, particularly as the physical symptoms of terminal cancer become worse, it dawns on them that they do have the terminal cancer, and they only have a finite time in this earth. That time they slip into deep depression. After the depression, ultimately, patient accepts that he or she has terminal cancer. What does the patient do in this situation, and what do the caregivers do in this situation? Let me talk about the caregivers first. The caregivers need to realize that the patient is going to go through a lot of depressive symptoms, irritability, as they go through all different phases. So the caregivers have to just be there for them, not be judgmental, not react, but just be there. Just be there for them. The caregivers have to be more proactive. They have to obviously support the patient, but they also need to gently nudge them to do the things that the patient enjoyed to do at one point in time.